So, if is this something that art therapy in general that someone could self-administer? Let's say someone's been through some sort of a trauma and they're, um, either physical, emotional, psychological. Is this something that you could do on your own that would help you to deal with those issues? I know a lot of people just won't, but is there are there courses out there that can self-administer art therapy, or do you recommend for somebody so you when they leave the hospital or they leave your practice, do you give them other exercises that they can do at home to help them emotionally separate themselves from the trauma or just deal with the trauma?
So, first thing is art is therapeutic, period. So, when the patients often leave, sometimes they ask me like, where can I buy these materials? I really want to do this at home just to relax or regulate. And I always give them resources. In terms of trauma, that's a different thing altogether. It's like it's hard to find a metaphor for it, but um, you can engage in arts practice and it can help you to relate or regulate. But when it comes to processing trauma or working through trauma, I think you should always seek the help of a professional. The reason being is sometimes when we are in that state, it is hard to think clearly. It's hard to process
Hmm.
things. Um, Clearly, and you don't have that feedback. And this is one of the issues with trauma and PTSD is sometimes people see things different from how they really are, and there's no sense of reality checking. And we get a lot of that in the outpatient. You have patients who come and they have all these experiences, and their narrative is one which is not necessarily the reality of what their situation is. So you develop all of these internal narratives. Um, if you are doing this on your own, often you don't have anybody to check back with in terms of these personal narratives that you've developed. You don't have that person to kind of feedback, okay, this is what is happening, or this is what I see. What do you think about that? Or it's not causing you to have that sense of processing from the outside. And one of the things that I always think about too is I don't know if you know about this, the Johari window is those things that you know about yourself and the things that other people know about you and that little unknown area. So I feel like it's so
Hmm.
important to have like that external voice sometimes who can give you like a more objective perspective. And that's the to me the usefulness of having a therapist or a therapeutic guide, because a lot of times you might go off into a direction that might not necessarily be useful on your own.